Yeah, good morning, everyone. I welcome everyone to this Oraposium of today. And this is Oraposium 25.0. And I would like to appreciate everyone who has always taken their time to be with us at our Oraposiums. And I am sure that you have benefited in a way or another from attending an oraposium. And I would like to start by reminding us that each oraposium you get to attend is brought to us by Oracle Inc. Oracle Inc. is an international, independent, oral and public health information, education, and research organization that is incorporated in the Republic of the Gambia as a charity organization. And at Oracle Inc., we prime acute scholarship and we catalyze proficiency in dental and public health professionals. And we try to redefine open science with our publications and with the way we give access to dental and public health knowledge. Today we are gathered to have Oraposium 25.0. And it is interesting to note that this Oraposium is focused on oral health promotion. And I am sure that many of us in the house today are dental healthcare professionals. And if there is anything that the Oraposium will do for every one of us today, it is to give us an idea of the kind of approach that we should have to oral health promotion. And I am sure that at the end of this symposium, you will understand your place and the kind of your place in oral health promotion and the kind of approach that you should be engaging with. At each Oraposium, we prime acute discourses. So it is not just about the person who is going to present the Oraposium of today. It is about you and I. It is about the questions that we ask. It is about the contributions that we make. It is about the kind of dynamic views that we bring to the subject matter that we are putting on the table today. So we expect everyone to share their experiences as we dive into the subject matter. We expect everyone to bring in their perspectives to bear on the discourse of today. And this is because we really believe that the discourses that we have at our Oraposium should inform the kind of policies that we evolve at the various levels of our existence, of our being, and of our practice. It should inform the content of what we teach learners. It should inform our practice in the clinic, in the field, and everything that we do. It should inform our teaching and it should inform learning. So you see that what we expect out of each Oraposium is a holistic kind of approach to the subject matter. I want to call on every participant this morning that as the presenter presents, you should note down the contributions that you want to make to the discourse. You should bring in the perspective that you want to bring into the discourse. You should share your experiences in the clinic, on the field, that you think will drive home the subject matter of today, the lesson of today, and you should come up with examples that can make what we want to discuss relatable. So once again, I welcome everyone to Oraposium 25.0. And we have one of us in the house, one of us from the Division of Oral Health at the Orapu College of Scholars. And he is the one that is going to give the presentation of today. His name is Dr. Ashek Elahi. Dr. Ashek is a dental surgeon from Bangladesh, and he is also an assistant professor. I'm sure that when he comes up, he's going to tell us a little more about himself before he gives us the lesson of today. So I want to call the presenter to the podium to share with us his heart about the approaches that we can engage to promote oral health this morning as I share his presentation. Give me just a minute to share his presentation with us so that we can see the presentation while he presents.
Thank you so much, sir, dear sir, for your kind introductions and greetings to you all. Good afternoon from Bangladesh to all of you. And today I present in Oraposium 25. My presentation was about the approaches to oral health promotion. My name is already Ashek Elahi Noor, and I am acting as an assistant professor in the Department of Dental Public Health in the Sapporo Dental College and Hospital, Bangladesh. And I am also a member of Oraposium College of Scholar. Today, my presentation's outline was the introductions of oral health promotions and oral health approaches, the framework for oral health promotions, and what are the approaches of oral health promotion should be, the conclusion part, and the references. And the end of this presentation, there is also a discussion session where you can ask me the questions related to these topics. And starting with my presentations, that is the introductions, that is the oral health promotions. How can we define? According to Point C, the public health actions to protect or improve oral health and promote oral well-being through behavioral, educational, and enabling the socioeconomic, legal, fiscal, environmental, and social measures. And now the oral health promotion approaches. It is aimed at improving the oral health of an individual or community or changing behavior that may have a negative influence on oral health. It ranges from individually focused interventions such as providing the positive oral health messages through to the development of national oral health promoting policy such as national oral health approaches. Now the framework for the oral health promotions, where the illness or oral health risks that is focused on individual, group, and the populations, where the strategy should be the lifestyle or behavioral, preventive, medical, or public health, where the behavioral adaptations changes to behavior that will improve our oral health, and the environmental adaptation changes to the environment that promote oral health. Finally, better oral health and well-being should be concluded. By this outcome, we can find the quality of life. Now, what are the approaches of oral health promotion should be? First one is the biomedical or preventive approaches. The second one is the behavioral change approaches. Third one is the educational approaches. The fourth one is the community-based approaches. Fifth one is the social change approaches. Sixth one may be the common risk approaches. And finally, it should be the holistic approaches. The first approaches, that is the biomedical or preventive approaches. The biomedical approaches which focus on treating and preventing oral diseases through dental interventions such as fluoride treatment, dental sealants, and oral health educations. There are the different level of preventions like primordial preventions, primary preventions, secondary preventions, tertiary preventions, and quaternary preventions. In primary preventions, the preventions of the emergence or development of risk factors. That is the examples like in primordial preventions, that is the preventions of the emergence or development of risk factors. That the example is the reduction of the sugary food productions and discouraging the children from adopting unhealthy eating habits. And the main intervention is through the individual and mass educations. In case of primary prevention, the action is taken prior to the onset of the disease, before the disease progressions, which removes the possibility that a disease will even occur, such as oral hygiene instructions, like toothbrushing techniques, and Pitts and Fisher's sealants programs. And the main intervention was the health promotions and the specific protections. In case of secondary prevention, the action which halt the progress of the disease at its incipient stage and prevent the complications. The main interventions are the early diagnosis and adequate treatment, like treatment of the incipient caries that we perform like restorations or fillings, screening test, like in case of different types of and other method of oral diagnosis, like which was usually performed in case of oral cancer or oral evaluation test. And the third one is the tertiary preventions, that is the reducing the further disability or preventing the recurrences of illness, patient educations, palliative care, and the tertiary healthcare is a specialized consultative care, usually on the referral from the primary or secondary medical care personnels, like denture fabrications. In case of dental caries, we can perform the root canal treatment or other fabrications like this. And the last one is the quaternary preventions, that is action which is taken to identify a patients or a population at risk of over medicalizations to protect them from invasive medical interventions and provide for them the care producers which are ethically acceptable. Electronic health records may in the future be able to assist us in avoiding the unnecessary report testing and medication error, thereby playing a role in quaternary preventions. Now the second approaches are the behavior change approaches. The approaches which aims to encourage the individual to adopt healthy oral behavior that are regarded as key to improve health. The behavior approach which focus on modifying the individual behavior to improve oral health, such as through oral hygiene education and promoting healthy dietary habits. The strategy were used to encourage the behavior change and popular with health promotion agency is the use of multimedia campaign. And the approaches are focused on modifying the individual behavior to improve the oral health. Example includes the educating the people on the importance of the regular dental checkups and providing the incentives for individual to maintain good oral hygiene. And then the approaches are educational approaches, which are strongly linked to the oral health education and seek to provide the knowledge and information on oral health and to develop the necessary skill so that the people can make informed decision about their oral health behavior. The community-based approaches, which is very much important in our life, the community-based approaches, which are focused on engaging the community in the design and implementation of the oral health programs, such as through the school-based oral health education program, community dental clinics, etc. Whereas there are some examples where we can follow in our oral health approaches. They are the community actions which has taken a successful programs according to the study of research paper, that is the strategies and the approaches in the oral health preventions and the health promotion by Richard G. Ward in Thailand, where the community approaches was taken places in Chiang Mai, where the empowering the local peoples, the National Thai Health Promotion Foundation has supported and encouraged a variety of community interventions to empower the community and foster their participation in health programs. In Chiang Mai, in the north of Thailand, rural oral health outreach program has been established with the local community is actively engaged in effort to promote better oral health. And the dental faculty in Chiang Mai is also developing the concept of health promoting dental school. One of the aim of this program is for dental students to engage with their wider community in activities for promotions of the oral health. So this is one of the example where the community action has been taken places in Southeast Asian. In addition, there are also some examples in Scotland where the school programs took participatory role to develop the personal skills, where the Scottish children have one of the highest level of caries experience in Europe. To address this problem, a randomized control trial was undertaken to assess the efficacy of supervised toothbrushing in school. The innovative elements of this program was the delivery of the intervention by the local mothers who volunteered to supervise the toothbrushings. A significant mean reduction in caries increment was found in the test group when compared with the control. That is, the personal skill examples was introduced in the school program to improve the oral health promotions. And now we moving to our another approaches, that is the social change approaches, where these approaches are focusing on addressing the social determinants of oral health, such as poverty and inequality. The example including the providing the dental services to low-income communities and promoting the oral health education in the school. It focuses is at the policy or environmental level, and the aim is to bring about the physical, social, economic, legislative, and environmental changes. And the approach is based on the notion that to promote the positive health is necessary to tackle and diminish the social and health inequalities. And another approaches that is on oral health promotion, that is the common risk approaches, where there are the different types of common risk factors are associated with the oral health promotions, and these approaches may be one of the major criticism of clinical preventive measures, and the dental health education has been the narrow, isolated, and and compartmentalized approaches adopted, essentially separating the mouth from the rest of the body. All too often, oral health programs has been developed in isolation from other health initiatives. The uncoordinated approach at the best lead to the duplications of the effort, but in fact often result in conflicting and contradictory messages being delivered to the public. The common risk approach recognizes the chronic non-communicable diseases like we know that the oral cancers is one of the non-communicable diseases, even dental caries, periodontal diseases, and other oral health diseases leading to detrimental effect on our general body. Like they have also the detrimental effect on, as we know that the periodontal disease have the relationships with the heart disease. Nowadays it is an established factor. Even also there is also the detrimental effect of diabetics mellitus. Even those patients who are suffering from diabetics are also associated with the development of periodontal disease, and it is a vice versa situation. There are also other diseases like mental illness and other oral disease, which are termed as the modifiable behavior risk factor. Is another factor like tobacco use, which may be associated with the development of oral cancer, because as we know that the tobacco, most of the smokeless tobacco and the tobacco product which contain the chemical like nicotine, and smokeless tobacco product like in local language, araquinates, betel quid, which may responsible for containing the aracholine, that is the carcinogenic substances which are associated with the development of oral cancers. And unhealthy diet leading to the obesity, which may lead to some other non-communicable diseases like diabetes, hypertension, and other mental illness. And also the harmful use of alcohol may lead to different types of diseases like lung cancer, oral diseases, oral cancers, and also others general problems. Some are the common risk factors that are associated with metabolic risk factors, which we cannot modify. The factors which we cannot modify, they are like raised blood pressures, overweight, obesity, genetic factors, which we cannot modify. We have to maintain their condition, and we have to control the situations so that further diseases cannot be improved. We have to maintain this. So these are the common risk approaches where we have to focus on. And the another approaches are the holistic approaches. The holistic approach, which considered the physical, mental, social, spiritual, dimensional of oral health, like providing the stress management technique, providing the information on the relationship between the oral health and the overall health. Now, some of the examples which we can promote in oral health approaches that may take place in our professionals, like tobacco use. As we know that the tobacco use is a common risk factors, which is adversely affect the general and oral health. As we know, a significant global oral health problem, as it was established, and the dentist and their terms are ideally placed to provide the advice on smoking cessations. Nowadays, it has become popular, more and more popular, to avoid the smoking or tobacco use, to offer the support to smokers and to become actively involved in broader tobacco control policy, like nicotine gum patch, tobacco cessation clinic, or some other supplemental or alternative method to avoid or quit the tobacco use, so that we can prevent most vulnerable diseases, which are like oral cancer and other type of cancers. Even for many years in the several countries, smoking cessation initiatives has been developed for the use in dental practices. A range of barrier has, however, been hindered major progresses in the important area of prevention. So the oral health promotions have taken some initiatives to stop the tobacco cessation in the clinical dental setting. That is, the reorientation of the services has been promoted in many countries, according to my knowledge. And other examples can be promoting like the health promotion schools, which can be initiated in the Brazil as a supporting environment to promote oral health as a primary approaches from the school that provide an initiation to promote oral health approach. So these are some examples where we should follow to implement the oral health promotions through different approaches. Now, the conclusions are the oral health promotion is an important element of the general health and the well-being. Although largely the preventable, many people across the world still suffer unnecessarily from the pain and the discomfort associated with the oral diseases. Although the above mentioned different approaches such as biomedical, behavioral, educational, and the community-based social common risk approaches were needed to implement at a grassroots level in our community in order to promote the oral health promotion for the people. Furthermore, it is also necessary to introduce some other approaches like the public health approaches, which address the public oral health as a population level issue through the policy and the programs like water fluoridations, oral health screening, and the oral health education campaign. Again, there is also an example of the water fluoridations where through these approaches, according to Locker and the McDonagh, in 2000, the quality of the studies to low to moderate estimated carries preventive effect. 40% reduction has been performed at the primary dentitions through the water fluoridation programs. And another approaches was the social ecological approaches, which considered the impact of the social, economic, and environmental factors on the oral health and address them through the multi-level interventions and the life course approaches, which focus on promoting oral health throughout the life courses. For an example, prenatal oral health education for the mother and the oral health education for the older adult in our community, so that the oral health promotional get the engage themselves to promote an effective evidence-based comprehensive preventive approaches, which is most important and the vulnerable part in these oral health promotion approaches to implement and to introduce and to communicate through the community and evidence-based comprehensive preventive approaches from the village level at rural area up to the tertiary level through the community clinic, like district level hospitals in my country, and the different non-government organizations or other oral health campaigns must be included to address and mitigate the major oral health promotional approaches among the community people in the country. So these are all about my presentations, and these are the references where I should include it. So thank you all for listening my presentation. And last one is that I believe and I also practice in my life that one message which encouraged me a lot, which I found in Orapo, that is the push yourself because no one else is going to do it for you. So this is a moral word that I follow in my life. So thank you all for listening my presentations. Thank you all.
Yeah, thank you so much, Dr. Noor, for that wonderful presentation. I am sure that everyone who attended this presentation has got something. I am sure that you have a point or two already to add to your practice. And we are now moving to the discourse aspect of the Oraposium 25.0. And I would like to call on us to share our experiences, our views or perspective on the subject matter. I'd like to give, first of all, a summary of all that we have listened to. You know, the presentation has brought to the fore the fact that oral health occupies a disadvantaged position in the scheme of things in many countries in resource limited settings. And if we are not careful, you as the professional may even be feeling that you've gone into the wrong field, may even be feeling that what you have chosen to study is very narrow. But like I observed when we were starting, oral health promotion should be the job of every dental healthcare professional. Whether you are just a dental healthcare professional or you are into dental public health practice, or you have as an area of specialization oral health promotion, we should all be into oral health promotion. And today, Dr. Noor has given us a number of approaches to oral health promotion. So I would call on us to reflect on the approaches given, and then you are to select the approach that is compatible with your area of practice, the approach that is effective to reach out to your audience or target population. Like we have all the approaches here, we have the biomedical or preventive approach. And in dental public health, when we say preventive approach, we are not just talking about the basic prevention that we know. You know, we are not just talking about, oh, prevent this from happening. We are talking about prevention on every level. And Dr. Noor has unraveled them from the primordial prevention, which is preventing the emergence of the risk factors of oral health problems in a population, you know, up until when you talk of something like the primary prevention, you know, the risk factors are already there and you want to stem their dispersal. And this is where you use strategies like oral health education, you use strategies like the application of topical phosphated gel, fluoride gel on the hard tissues. You know, you are talking about specific protection and education. And then you move on to another level of prevention, like the secondary prevention, where the risk factors are there, the disease has occurred, but you want to prevent the spread of that disease that has occurred. And you use strategies like early detection of oral health problems, where you look at, for example, for signs of incipient caries, you look at, for example, for changes in the periodontum. You're looking at the color of the periodontum of the gingiva, you're looking at the consistency, and then you are trying to decipher if a periodontal problem has ensued in that oral cavity. And then the next strategy is prompt and appropriate treatment. And you are looking at the gingiva, for example, you are thinking what should be done. Maybe this individual should go for SRP. Maybe we should give strain and punishment to this individual. Or this individual would benefit from curable subject. The disease has become advanced. This individual may benefit from gingivectomy and all the rest. No, they are still part of prevention. Or you get to the tertiary prevention, where we talk about strategies in rehabilitation. For example, you are trying to provide dentures, you are trying to provide other prostheses to aid the functions of the oral cavity. Or you talk about the quaternary, where you are trying to prevent over-medicalization. You don't want people to enter into a community and they are extracting everybody's teeth. And you say, what do we do? Okay, let's launch a program, preventive program, let's get into the community and then try to prevent disease from getting to that advanced stage where people will have to have the radical treatment of extracting their teeth. That is the biomedical approach. Look, the primordial, the primary, the secondary, the tertiary, the quaternary. And thinking about your practice now, you should be thinking, should I just focus my practice of oral health promotion at the biomedical level? Should I just approach oral health promotion from the biomedical approach? And then you may also say, okay, no, let me go to behavioral change approach, where I will not just be talking about education. Even education is an integral part of that approach. I also want to change their behavior. You know, maybe I'm thinking about teaching people how to brush their teeth properly. You know, I am teaching about getting people to attend the dental clinic. And then when they attend dental clinic, I am also concerned about their adherence to the instructions and the prescriptions that are given, the dental advice that is given at the clinic. So I'm trying to change their behavior. I'm trying to get them to take care of their oral cavity, to brush properly, to use dental flosses. I'm trying to get them to brush in the morning and at night. And I'm also interested in the period of brushing. I'm telling them brush after breakfast and before bed, you know. Or I just want to concentrate on the educational approach. You know, I may even have to have an organization where I am concerned with oral health education, you know, teaching people about the prevailing oral health problems in the community, and then trying to tell them what to do to maintain good oral health. Or the community-based approach. Dr. Noor has talked so much about the community-based approach. And I just want to talk about one or two things there, because it is as if we as practitioners neglect the community-based approach. You know, it is under this kind of approach you have the community dentistry, bringing dental treatment to people in the community. And here, when we talk about the community, we are talking about a subset of populations. So you may be talking about a correctional facility, a prison, or you may be talking about a school, you may be talking about an old people's home, you know, all about community, or a rural village. They're all communities. And this school-based approach, we do not do that as often as we ought to do that. You know, many of us even have organizations that reach out to people, but we are not actively engaged with the school-based approach. Maybe because we feel there is no money coming in from that angle. But you can get sponsorship from your local government chairman, or your regional or district government mayor or chairman, whatever is designated. And we need to do more at the community level, because that is where the people live, that is where they work. All this social change approach, you know, where we can use strategies like advocacy, strategies like influencing policies, and majorly trying to alter the social determinants of health, like the purchasing power of an individual, that talks so much about their ability to purchase oral health goods and services. or we talk about the need for education. In fact, modern research has linked level of education to the ability to adopt oral health advice and to stick to oral health prescription or treatment regimen. So we need to think about that. And if you ask me, the social change approach should be the chief of the approaches that we have to oral health promotion. And then the common risk approach. Think about common risk factors to oral disease like the dental plaque, oral biofilm, like unhealthy diet, like the use of tobacco, like the use of alcohol, and other, the modifiable risk factors. Or you think about other non-modifiable risk factors like genetics, like Dr. Noor talked about, and then we have other ones like race. You know, if you go into the intricacies, you will see the link between those risk factors and the development of oral health problems. And the holistic approach, where you engage the whole dimensions of health in a holistic way to bring oral health promotion. I think I've taken so much time giving a summary of what has been taught. So I want to throw the floor open to people who have contributions or questions or persons who want to share with us their experiences at their level of practice and what they are doing in their communities. Thank you. So if you have things to share with us, this is the time. And if you want to leave yours as comments on the platform, you can also do so. Okay, since no one is talking yet, I have a comment here that says, thank you, Dr. Noor, for a good presentation targeted at addressing the various approaches to oral health promotion across our different nations. Once again, thank you to Orapu for the privilege of gaining access to knowledge relating to oral and public health. This is from Jessica Watu. Jessica Watu is of the Public Health Division of the Orapu College of Scholars. Any contributions before we close for today?
Hello, good morning, everyone.
Yeah, good morning.
Yes, I want to commend the effort of Dr. Noor for his presentation, and I want to make a little contribution based on the approaches he listed. If you consider his explanation with the contributions, sorry, the summary you've made, you find out that it is very important to have these approaches inculcated into public practice, especially the community-based approach. Because if we try to use the community-based approach, we find out that other approaches will also be included. We try to educate the community, give them from there, the behaviors will change, social habits will change, risk factors will be avoided, so on and so forth. So it's a very good presentation. He has done a very good job. Well done to Dr. Noor. Thank you.
Thank you so much, Ms. Umar, for that beautiful contribution. Ms. Umar is saying that the community-based approach may even encompass all other approaches. And then there is the need for us to learn to engage oral health promotion at the community level. And I think that this is the core of some of us who are at the training schools for oral healthcare professionals. if it is possible for us to push for the inclusion of the various approaches to oral health promotion in the curricula of training, it will be good, so that we have professionals who are coming fresh out of school already armed with the ways, the various ways they can contribute meaningfully to oral health promotion. Thank you.
Thank you, sir.
So if we have contributions, we can bring them forward.
Hello, good morning, everyone.
Yeah,
Good morning,
morning.
Dr. Biadani.
Good morning.
Mr. Ashek, good morning.
Good morning.
Thank you very much. My own is to commend the effort of Orapo. Orapo has grown up. A lot has happened in Orapo, and we have even gone dynamic. So what I just wanted to add is a compliment to Dr. Ashek from his contribution. I've seen in Bangladesh, government have incorporated these approaches. That's the difference between Nigeria here, because they have been utilizing their community clinics through the biomedical, preventive, behavioral approaches, educational, community-based, whatever. By so doing, you find out that using especially the behavioral approaches, you find out that a lot will happen and change the oral health status, and even prevent a lot of oral disease conditions that affects our individual or patient in the community as well as the globe. So I'm just commending this effort. As Dr. Ashek responded, that if this will be inculcated into the curricula of our dental curriculum, I think it will be of an importance help. It will help our dental professional to become more elite and to become more professional as well in oral health promotion. I think this is just what I have to say. I just commend the effort of Orapo for bringing this far to us. Thank you very much, Orapo. We are grateful. Dr. Ashek, we are glad you are here. Thank you very much.
Thank you. Thank you so much, Dr. Ms. Halima.
Okay, yeah, thank you, Mrs. Mohammed. Thank you so much for that beautiful contribution. And Mrs. Mohammed is also lending her voice to the call of enriching the curricula of training of dental healthcare professionals with some of the ideals of this presentation. Thank you, Mrs. Mohammed, for being a part of Oraposium. Thank you for your contributions. Thank you for attending events and contributing to the discourses. Now we have this comment from Hilbert Camel from Cameroon. He says, thanks very much for the presentation and the comments done. He has learned so much on the different oral health promotion approaches and the examples that Dr. Noor gave. He trusts will guide every one of us in our daily activities and practice. Thank you so much, Hilbert Camel from Cameroon, for that beautiful comment. And then we have NIF Eneojo from the Gambia. She says, thank you, Dr. Ashek, for the presentation. Please, if you have contributions to give and you have perspectives to contribute, this is the time to give them. You have experiences you want to share with us, or there is something you are doing at your local corner to contribute to the subject matter of this morning, you can share with us so that we get to know what you are doing. Thank you.
Thank you, sir.
Okay.
Thank you, sir. Thank you so much, sir. And all of you. Thank you so much, sir.
Yeah.
for your kind introductions and everything, sir. And I am very much glad to be a part of Orapo members, sir. And thank you all, sir.
Yeah, thank you, Dr. Noor. We are also glad that you are here. Thank you. So I want to thank everyone for attending Oraposium 25.0. And I would like to tell us that Oraposium 26.0 will be taking place on the 18th of this month, the month of March. And this time around, we're going to be having someone from the Public Health Division coming to share with us health research methods, coming to tell us everything, every method, every technique that we need to engage health research.
Are you the husband?
I call on us to make that a day with the organization.
Are you shown her? Mama, I'm going to get you. Why you marry and back? Do you think I'm your husband?
The day.
Do you think I'm your husband?
26.0. Thank you
for attending.
Thank you so much for coming today. God bless you all. Bye.
Bye. Bye.